Good afternoon, everyone. So, myself, Dr. Prathamesh Kaur, and I am a resident Masters in Physiotherapy student from Community Department. And welcome to class series. Today, we will be discussing about the breastfeeding positions. So, by the end of the talk, our audience will be able to understand what are the benefits of proper breastfeeding positions, what are the breastfeeding tips the mother has to follow, and what are the various types of breastfeeding positions. The first one will be what are the benefits of proper breastfeeding positions. So first one will be the baby will be feeding well. So when the baby is positioned correctly, they get a bit mouthful of breast milk and attached well. So nipple soreness will be reduced and mother feel more comfortable. Second, what are the various breastfeeding tips the mother has to follow? First one is the good latch. So the mother should not feel any pain while breastfeeding the child. More areola is visible from above and for above your baby's mouth than below. Then baby's mouth is widely opened. Their lower lip is turned out and their chin is touching or nearly touching the breast of the mother. So what are the good positioning, signs of good positioning? So the baby's head and body are in line. A baby cannot suckle or swallow easily if their head is twisted or bent. The baby is held close to your body. A baby cannot attach well to the breast if they are far away from it. Third, the baby's whole body is supported by your arm along their back. This is particularly important for newborns and young babies. For older babies, support of the upper back is usually enough. Fourth, the baby approaches breast nose to the nipple so that they come to your breast from underneath the nipple. So what are the signs of the effective suckling? First one, a baby takes slow, deep suckling, sometimes pausing. Mother may able to see or hear the baby swallowing after one or two suckles. Suckling is pain-free and comfortable for the mother. And baby, when the baby finishes the feed, releases the breast and looks contented and relaxed. The breast is softer after the feed. So what can be the benefits while having the breastfeeding position? Like first one is the skin to skin contact, and what can be the benefits for it? So first one will be it calms and relaxes both mother and baby. Skin to skin regulates the body's temperature, heart rate and breathing. Third one is stimulates digestion and an interest in feeding. And last one is it helps provide protection against infection. So what are the various types of breastfeeding positions? So first one is the cradle hold, second is the cross cradle hold, third is the underarm hold, football hold or rugby hold, fourth one is sideline position, and fifth one is the reclining position. So coming to the cradle hold, so the cradle hold is most common position and helps to provide an enjoyable feeding and bonding experience for both mother and baby. So mother has to sit somewhere with support to keep the arm at right height, like an armchair or couch. If they need it, they can use pillows for the support of the arm. Position the baby in your lap with their head in the crook of your arm. Keep your baby's chest against yours so that they don't turn to so they don't have to turn their head towards the breast, and if necessary use pillows for to support your baby's head. So in this image, as you can see, the baby's head is well supported with the mother's arm, and she is using a pillow for support of her arm. And with if one hand is supporting the baby, the with the second hand she can hold her breast and take towards the baby, and baby can suck properly. Second one is the cross cradle hold. So cross cradle hold is useful when the first learning to breastfeed. The mother is first time learning how to breastfeed and is great position for smaller babies. It allows the mother to have good control of the baby's head while helping the baby to latch on. So first, how can this position be held? So bring the baby across the front of your body, tummy to tummy. Hold your baby with the arm that's not the same side as the breast you are feeding from. This means left arm of the right breast and a right arm for the left breast. Support the back of a baby's head with your open hand. With the other hand, support your breast from the underside with the U-shaped hold. Guide the baby's mouth to your breast. Yes, one thing they have to remember is the mother don't have to bend over or lean forward. Instead, cradle your baby close to your breast. Try to hold this position so that baby is not having trouble while having breastfeeding. And this is called latching. So it may give you control. So it may give you the control you need to guide the baby into a good latch. So in this picture, you can see the mother is using her right hand to support the baby for the left breast, and she is using her left hand for keeping the breast in the in a good position to so that the baby the latch can be held properly and the baby can suck properly. Third one is the underarm football hold or rugby hold. So in this position, if the mother is dealing with engorged breast or sore nipples, this is great position to try. This hold helps to prevent plugged ducts by positioning the baby to a empty bottom. And also the football or rugby hold is also useful if you have undergone a cesarean section and can't place your body on your stomach while nursing. So how can this position be maintained? So the mother has to turn one side, hold the baby like a football or rugby ball along with the forearm of the mother, with the baby's body on the arm with your arms and face towards your breast. Position your baby's legs under your arms and use your other hand to support your breast. So as you can see, the baby is holding baby with the other hand, and she is holding like a football or rugby ball, and with the other hand she can hold the breast towards the baby's mouth and the baby can suck properly. Fourth one is the sideline position. So in the sideline position, if the mother and the baby are more comfortable lying down, this is the most great position to try. So the mother has to lay on one side and place the baby on their side facing the mother with their head at their So the mother, if the mother and the baby are more comfortable while lying down, so this is a great position to try. So mother has to lay on one side and place their baby on the that side, facing the breast of the mother, and support the back with the pillows and make sure that the baby's nose isn't obstructed. So as you can see, in this position, the baby is the mother is in sideline position, and with the one hand she is holding her breast while supporting the mother's while supporting the she is with the one hand she is using with the one hand she is holding her breast so that she can feed the baby properly. Last one is the reclining position. So for if the baby is has a difficulty latching or is restless and crying, so this is the calming position to try. So in fact, this position is sometimes called biological nurturing. So for this, the mother has to support herself with the pillows and lean far enough back for a baby to be fully supported on the reclining body. And the mother has not to be completely flat. So lay the baby prone on your chest. So as this position, you can see in the reclining position, the mother is using pillows for her to be in a reclining position. The baby has to be in prone position and has to be fully supported, and so that she can feed the baby properly. So thank you for patient listening. Thank you so much, Manisha ma'am, for giving me this opportunity. Thank you so much, Apurva sir and technical team for guiding me, and thank you.